So let's talk about what we're looking for when we send you down to get your blood drawn for a CBC or a complete blood cell count. The CBC will report out many different numbers, but we're going to talk about what's most important in CLL. So within your bones is your bone marrow, which produces three main types of cells. One is your hemoglobin, or your red blood cells, which are responsible for carrying oxygen to various tissues in the body. The second type is your white blood cells, or your leukocytes, who are primarily responsible for helping fight infections. Finally, you also have platelets, which are important in what's called hemostasis, so they help your blood clot in the event of a bleed. But let's talk some more about those leukocytes, or white blood cells, because there's quite a few different types. The different types of white blood cells will be reported out on what's called a differential. So there you'll see things like neutrophils, lymphocytes, monocytes, eosinophils, and basophils, all of which are different subtypes of white blood cells. The lymphocytes, though, are what's most important in CLL because that's where the problem lies. What happens is you get this clonal expansion of mature B lymphocytes, or mature white blood cells. It's kind of a silly illustration, but I think about them kind of like the stormtroopers from Star Wars, where they all look the same, but none of them are very good at their job. If you're interested in finding out what happens next, you can check out my next video on where CLL cells accumulate.